Dr. Shahid Jameel, can I come to you first? Similar to what I'd asked Dr. Swaminathan as well, given what we have just seen, can we then say that mRNA vaccines perhaps were safer?
I don't think there is any evidence to say whether one vaccine is safer than the other, but there is very clear evidence that all vaccines used during COVID, during the pandemic, are safe and their benefits far outweigh the risks. We have to understand that there is nothing that is 100% effective or 100% safe. We have to weigh benefits against risks. Remember, we were in a pandemic situation, and you cannot test a vaccine with a 1 in 100,000 risk in any clinical trial. Clinical trials were done mainly with about 30,000 people in phase 3, half of them getting the vaccine and half of them getting a placebo. So in a 15,000 population, how can you assess a 1 in 100,000 risk? It's impossible. So, and also the other thing to understand is that whatever risk that AstraZeneca has sort of admitted to is within the first 42 days of vaccination. We are far, far away from it, in our vaccination program. So do consider these things. And may I also add that there are also studies now that have shown that globally all vaccines, all COVID vaccines have protected about 14 to 20 million people from death. In India, a study from Stanford University shows that India's vaccination program protected about 3.6 million people from death during the pandemic. So benefits far outweigh the risks.
Okay.